You can also take symptoms first and then save it to a patient. So let me take here again a few symptoms. Okay, I have here 3 clipboards with each symptom. Now I want to save it to a patient, and I do not want to use here the list of patients. So that you can do also in the following way. You right mouse click on one of the clipboards and save here Save Analysis, and on Windows that's also Ctrl S, or on Mac that is Command S. Then you have here 2 options belonging to the patient file. One is save the current analysis to an existing patient, and the other one is you save the current analysis to a new patient. So let's do first the existing patient. Now if you just select the name of the patient, so you can imagine later there will be a long list of names. If you only select the name of the patient and not a consultation date, so let me do that. I select here only the name of the patient and I say save. It will ask you if you want to save it to a new consultation. So if you only select the name of the patient, it will automatically create a new consultation date for that patient. If you select an existing date, an existing consultation date, it will save the analysis to that consultation date. So if I say here, yes, I selected here only the patient name, the question will be, do you want to create a new consultation for this patient automatically? And I say yes. So you can see now that for that patient, that Jenny Goldstein, if I open it, and if I have an overview of the consultations, it has here the first consultation, and then it created a new one, the second one, where it saved here 3 symptoms in total. Okay, let me close this, and let me close this. So now I will save it to a new patient. So let me take 1 or 2 symptoms. Then I right mouse click, or on Windows Ctrl S, or on Mac Command S, save the analysis. And in this case I say save the analysis to a new patient. And I type, for example, here Johan, and press on the keyboard the tab key. Sure, and I press on the keyboard the tab key, and I give it, for example, the birthday 09, 04, and 2020. And I can also type some consultation text, a brief note. I can say here acute bladder infection, and press here save. Then you will see in the list of patients that this patient has been added. So there it is. Sure, Johan. Let me clear here the clipboards. I say clear all clipboards. Okay. If I want to recall the symptoms of this patient, I click here on Johan Sure, and you will get the question, do you want to recall the last symptoms, the last analysis of this patient? So the last set of clipboards you have saved. If I say yes, it has not only opened this patient file, but if you look here in the analysis and in the clipboards, it has recalled also these symptoms. So this was how you can save the analysis to the patient file. Let me close this again, and let me close this, and let me close this. So if you want to use the patient file to save the analysis to it, there are two ways. Or first, when the patient comes in, you click here on the list of patients and you recall an existing patient, or you create the new patient and then you start to work in the repertory or type the consultation text. The other way is that, let me close it to make it more clear, the other way is that you first take some symptoms and then right mouse click and say save the analysis, and you can save it to an existing patient, to or the patient's name only, and it will create a new consultation date, or you can select the consultation date to which the analysis should be saved, or you can save it here to a new patient. So I think this was it.